people who are forming the panel today in this discussion. We have Dr. Girdhar Gyani, who is currently working as a Director General, Association of Healthcare Providers India. Prior to this, he was the Secretary General of the Quality Council India, an apex national body responsible for establishing and operating national accreditation structure and promoting quality in all walks of life. He introduced a number of measures integrating quality into regulatory frameworks in the areas of education, healthcare, environment, industry, and public services, which have led to the development of good governance practices. The SME World magazine, in its cover story of the June 2012 issue, described him as the quality man of India. We also have Dr. Vijay Agarwal, who is a postgraduate in pediatrics from the Maulana Azad Medical College, New Delhi. He is the Secretary General of the Consortium of Accredited Healthcare Organizations. It's known by, more popularly by its acronym CAHO. He was responsible for setting up Max Saket and Pushpanjali Crossley hospitals. He is an honorary advisor to the Global Association of Physicians of India. Dr. Agarwal has played a central role in creating strategies for national programs of global importance, such as the Pulse Polio program. He was a member of the Delhi Pollution Control Committee and has been instrumental in introducing and implementing the concept of centralized hospital waste management scheme in Delhi. He is also the founder president of Society for Child Development, which works with children with special abilities. And we have another very stellar pillar of the healthcare paradigm in India, Dr. Alok Roy, who is the chairman of Medica Group of Hospitals, which has 11 hospitals across central and eastern parts of India, with their flagship hospital in Kolkata. He also co-chairs the Health Services Committee of FICCI, that is the Federation of Indian Chamber of Commerce and Industries, having done his MBBS from SCB Medical College, Cuttack, and post-graduation from All India Institute of Medical Sciences, Delhi. Dr. Roy began his career in Calcutta in 1987 as a senior consultant in nuclear cardiology. Over the years, he has helped build up more than 19 hospitals like the BM Birla, the Manipal Heart Foundation, and Manipal Heart Foundation in Bangalore, and Narayan Hridayalaya in Bangalore. So with such a stellar panel, I think we are in for a treat as far as the discussion on telehealth in COVID pandemic and beyond is concerned. Just before I request them to start the session, may I request General A.K. Singh there is yeah. Can you see my screen, please?
Okay. Yeah, we can see that.
Yeah. So, General A.K. Singh, may I request you to kindly release this report, which is a joint effort by Practo and TSI at your behest. And this report would be available from the Practo stall in the exhibition area from tomorrow onwards. General A.K. Singh, sir.
My pleasure. It's a wonderful thing that you people have done. I went through it and I found it was quite interesting. Now, please make it available to the public and let it be floated into the TSI website. It will be perfect. Now,
thank you, sir.
The stalwarts that we have, Dr. Roy, Dr. Girdhar, and Dr. Vijay Agarwal, my welcome to you. It'll be a pleasure. I am a bold man sitting with my shawl. Sardi bahut hai in Jaipur, and equally in Delhi it's there. So let's heat it up. As an outgoing or president of TSI, I would request all three of you to sort of join hands with the TSI and let's take out a white paper on what we want the government to do about it. All of you have got your secretariat. My secretariat, my granddaughter has pushed off to Gurgaon. I don't know what to do without her. So I would request you that would be a formal request to you from the TSI. Ashvini is the president now. So the baton has been passed to him. Please take out time and guide us to take out a white paper with your influence, with your things, a TSI and you people. It'll be a fantastic thing. Welcome, sir. Welcome.
In fact, sir, between you and me, Dr. Girdhar Gyani has been a pillar of support for us
Yes.
since a very long time.
Correct.
So has been Dr. Vijay Agarwal and Dr. Alok Roy. I remember very fondly the symposium he had organized in Calcutta 2 years back. And I had the pleasure of availing his hospitality in Calcutta. And of course, we've been meeting in the FICCI conferences off and on. And I'm sure with his support for telemedicine, great things are in the offing for telehealth in India. So
I have one submission. There's a lot of talking. I think we have had enough of talks. We have to now go straight. Yesterday, Dr. Vinod Paul had mentioned a lot of things. The justice had said something. We have to do an internal inclusive thinking between all of us and then come out with a paper. That would be an ideal thing that can happen. And with your people that are all three of you there, we'll love to sort of participate in that paper. Thank you, sir.
Well, gentlemen, you see, as they say that a decade's change has come about in just about a month's time. So with the advent of COVID pandemic, there is an exponential increase in the number of online consultations. And of course, the major advantage of the entire thing has been that the floodgates have opened after the issuance of the telemedicine practice guidelines. So I would like to begin the session by addressing a question to Dr. Alok Roy. Continuity of these services is crucial to transforming healthcare in India for the long term. As an apex healthcare body, how can the Federation of Indian Chamber of Commerce and Industry Health Services Committee help the government agencies, healthcare providers, and healthcare technology firms realize this goal collectively? Dr. Alok Roy, please.
Thank you. Thank you. First of all, thanks for inviting me. Sir, the biggest help you got from the Mother Nature, which came in the form of pandemic. It reminds me that somebody who's very reluctant to jump into the swimming pool because he's very scared of water. So that was telemedicine. Government of India had not come up with any guidelines. And suddenly somebody pushes him in the water and his fear goes away. Exactly the same thing happened to all of us. We have been talking about telemedicine for so long. We have been requesting government for setting up some criteria, something, but government was happily sleeping with the ears closed. One pandemic, government has come with the guidelines, and now it has shown the true nature. 85% of people have used telemedicine. Over 6 crore consultations have happened. Can you imagine? What else you want? You have a nature helping you, sir. There cannot be a better time than this to accept it and keep on pushing for it. I think you have all the limelight. It is similar to if anybody thought that the healthcare is not required for economy, has really eaten the dust. It has been shown very clearly that without health, there's no economy. Without telemedicine, there's no healthcare. That's how you should think and talk and push for now, especially.
Thank you, sir. That was very relevant and pertinent indeed in the current context. If I may ask, you see, with the stigma attached to diseases and disorders, that saw many patients being pushed to the dark is now easing out, with telehealth enabling them to remotely reach out to doctors without any fear of hesitation. So, Dr. Girdhar Gyani, if I may ask you, what, according to you, is the best way to keep the curiosity intact amongst the demographies and encourage more people to access healthcare digitally without the fear of being duped? Because this is with relevance to the floodgates being opened and anybody and everybody jumping onto the bandwagon of telemedicine. So this is very pertinent as far as the issues related to quackery and unregistered practitioners.
Yeah, I think that's a very key point. So let me say, start from what Alok mentioned, this pandemic has done few good things to us. One good thing is that we have realized now how bad we are in terms of the healthcare delivery system. With a 1.3 beds per 1,000 population, which is supposed to be 3.5 beds per 1,000, we will take maybe 10 years, even if you put any kind of efforts to come up to that level. Second, we realize that the tier 3 towns and even many places tier 2 towns have no specialist available. So I think this point has come first time in our knowledge. Otherwise, we were not bothered about it. We were just sleeping over it, And so I think this is a time we have to pitch in with our telemedicine, network. So your question is now, how do we really make it happen in the real terms? Because one is hesitation on the part of the physician, because many of the physicians are still not, coming up to that level or used to, using the telemedicine. Although this pandemic has made them to, try it out, but this now has to become habit, because maybe next year onwards, the pandemic effect may go. So I think we have to now systematize the use of telemedicine as a part of the normal healthcare delivery. I think that is where the role of association like ours, association like FICCI, and association headed by Vijay Agarwal, all of us, I think, have to come together. And we have to educate our members and promote, number one. Number two, we have to do equal things with the community. I think we have to educate community, because many of our citizens or population still, they are not, one, aware. Secondly, they also have the same hesitation that how can a doctor give us the consultation on the, virtual one. So I think you have to work both ways. So the society sensitization is going to be a little difficult task, and which I think together only we can do it. And we have to take government also along with us, like even the consumer forum, for example. The Ministry of Consumer also has to be brought into the picture, and they may have to make them realize that this is something, the shortage of the healthcare personnel, facility, infrastructure can be largely compensated by this. So I think we are actually right time. The healthcare must come in a new avatar from now onwards. And this is the time for all of us to join hands together and make it happen.
Thank you, sir. Very well put. I think all these the four organizations, associations over here who are present here, if we join hands, I think great things can be accomplished.
Dr. Girdhar, I will agree with you 100%. I come from a very small village. It's in Churu district. It's about 22 kilometers from the nearest medical setup. And I took the liberty of getting a grant from PSI for research, and I put it up there. Okay. You are very correct when you say educating the community, educating the population. Yes. When I started talking to them, it was something very amazing in the sense that first thing that they told me was कि डॉक्टर साहब डॉक्टर किधर है? तो मैंने डॉक्टर यार जयपुर में बैठा है. तो जयपुर, how will I go to Jaipur? So one thing that I now realize is what the Prime Minister says is go local, go vocal. So my next task, the minute this COVID thing little dies down, I'll be going to my village, and the nearby this thing, I'll be convincing the doctors, Bhaiya, take on telemedicine, help out the crowd. So you're very correct that the population has to be sensitized. Right. Thank you.
Thank you, sir. Thank you, sir. Dr. Vijay Agarwal, sir, see, there is, after the pandemic subsides, AI-enabled care will complement face-to-face consultations in providing patients with comprehensive round-the-clock diagnosis. I know that you've been speaking about it earlier also. And so I would like to ask you, how can we ensure more innovation and continued support for companies who are providing technologies built on AI, cloud computing, robotics, and intelligent edge, which are already touted to transform healthcare. Your thought process on this, sir.
Thank you. Thank you for making me a part of this very interesting discussion. And so my thought is that, anyway, at the moment, we are living in very artificial kind of a push that has been created by this pandemic, which has been already talked about by Dr. Roy and Dr. Gyani. The thing is that I don't think that any of this, like artificial intelligence or anything, should not take away the eyes from the fact that we have very inadequate health infrastructure in this country. Ultimately, telemedicine can only augment what you have as a proper health infrastructure. Otherwise, like what we had a very uneven health infrastructure in the country, and same thing will now happen in terms of a digital divide. So when we talk about artificial intelligence, robotics and all that, you will create a cluster of people who are elite, will be able to have that kind of a bandwidth, they will be able to assess that kind of a care, but the vast majority of the country will not be able to get the benefit of any of that, because we have not prepared the community even for, I would say, accepting the basic digital needs. We have to start from very rural areas, we have to start from tier 2, tier 3 towns, and we have to look at the ground root realities there. Unfortunately, most of us who are present in the metro towns are not even able to comprehend. I'll tell you one thing, that even the normal, our video consultations and this thing are today having a great problem in terms of the bandwidth of available to the people in terms of even telemedicine or any kind of a video consultations are greatly hampered because we do not have a proper bandwidth. I do not know why the government has to take steps to increase the spectrum, increase the bandwidth available, so that people have a good experience. You see, otherwise, let me say one thing, the greatest proponents of this are going to be the clinicians. It is the doctors who will be able to convince the community, and the community will get ready. So you are going to get certain aspects will definitely kind of, it will keep working. But I think it is a lot of work in progress, and it's a great opportunity. But I think that unless people in the government and of course the organizations, they should be ready to listen to the organizations. The problem is that they have their own mindset and they don't want to listen to any sane advice. So that's what I feel, that we have a country at the moment which has a divide in terms of the kind of the healthcare that is being provided. Being provided in Mumbai, Delhi and Bangalore is very different than what is being provided in Muzaffarnagar or you go beyond. And same thing is likely to happen when this digital health becomes a reality.
Very well said and very well put, sir. You addressed the question of the humongous healthcare divide that besets our country in very succinct and hard-hitting terms. Yes, of course, the powers that be always have their own priorities to cater for on the larger perspective. So, of course, and be the healthcare people who are concerned with healthcare often feel maybe at the cheated. Maybe maybe that's an inappropriate word to use, but the kind of budget that has been allocated to healthcare over the past so many years has been grossly insufficient. So, having said that, one last question to all of you, because I know Dr. Roy also has his commitments. He's to leave, and we have a next session coming up. See, we witnessed the need to harness the potential of technology in lifestyle and chronic disease management cannot be stressed enough. So what role do you think these new age healthcare companies, which are providing platforms for the practice or promotion of telehealth, like Practo and others, what is their role? What will it be play in making healthcare more inclusive and patient-centric? Some thoughts on this aspect, if you, Dr. Roy. Yeah.
Please, let's not underestimate the digital power. Just don't go by the well-organized telemedicine consultation. All of us consult digitally at least 5 to 10 times a day, which is never gets recorded. We have never seen an X-ray film. We have not seen a CT film. We don't see any angioplasties on films or CDs. We have all switched over to the WhatsApp. Simple WhatsApp has transformed. If one person who has to be given the credit of so-called telemedicine, I think WhatsApp has the biggest role in it. Very innocuous, very innocent. Such is life. Most of the time, the simplest things are probably get used maximum. Number one, having said that. And if you look at the maximum startup in the country, they are into this platform where they want to use, bring from business to consumer directly. And the role of Practo and others, those who are there, like now they're trying for the Swast, where a lot of people have come together. It just goes to groove. The digital is the way to go forward. See, what we were trying to do earlier, see, we all have been telemedicine I'm there personally for last 25 years, trying to promote telemedicine in this country. 25 years is a quarter of century. We were episodic. Now we have to move from episodic to wellness-oriented care. It can't be just one time. It will be wellness-oriented. We have to help them. And such Practo and others, Libra and iClinic and all those people, they are very, very useful into this. We have to move from, the access will change fundamentally. The very fact, all the e-consultation, e-pharmacy, and everything e-commerce coming into it, it's another way of looking at where we can monetize a lot of things. One of the reasons why telemedicine could not succeed was the lack of ability to monetize.
Absolutely, yeah.
That's another second factor. To move from episodic to wellness, be able to modify it, bring affordability, and volume-based should move to value-based. And last
very well said, sir. Yeah.
And last point, that it has brought a lot of trust in the physician. Earlier, trust was only physical. Now people have trusted, and now they have trusted not only for first time, they also trusted for refills and follow-up and all that, which now the law permits. So you have suddenly opened up huge Pandora box where we all can change, and we have to change our character. The way what has brought telemedicine to Society of India here, same rules will not apply going forward, because you have a lot of people supporting you, a lot of companies are willing to come in, there's ability to monetize. One sleight of hand of government has changed your future. I think we should work together and ensure we don't grow. We grow in geometric progression, like
exponentially. Yes.
All areas. I think that's possible. So, I must take off from here. I would have flight.
Yeah, may I go on to Dr. Girdhar Gyani? If you could amplify on what Dr. Alok Roy said, in fact, with special reference to when he said value-based healthcare. You've been involved with quality ever since the concept of quality came into India. Very few quick thoughts from you, sir, and then I'll ask Dr. Agarwal, because we have another international session coming up in this thing. We'll make it quick.
See, for you, I think one basic thing is that there are two major programs the government has launched already: National Digital Health Mission and the Ayushman Bharat, where 1.5 lakhs health and wellness centers are coming up, where screening will be available. I think you as a society along with all of us have to pitch in and be with the government, because this is the opportunity. National Digital Health Mission and these wellness centers, if you can work together, because in National Digital Health Mission, mapping is also one of the components. What Vijay was talking, that you have shortage of the beds here or hospital, mapping is also going to tell you which are the populated area where we have lack of the hospital or community health center. So I think these two programs, if government can take all of us along with it, which sometimes government misses out, I think we can produce wonderful results for the world.
Thank you, sir. Thank you, sir. Dr. Agarwal, your thoughts on this, what Dr. Gyani has just told us? You're muted, sir. You're muted.
I would like to say that, first of all, I would like to take what Dr. Alok Roy said, that in terms of the reimbursement of the telemedicine or the virtual consultation services is extremely important, because without that, it is going to suffocate. No physician is going to go forward with it. You must understand, whether it is any of the private organizations like Practo, anything, everybody is coming forward for some kind of commercial gain also. So is also true for the physicians, who are the prime drivers of the telemedicine services. And therefore, I think the reimbursement of these services must be at a war footing. And therefore, the community has to get ready that they have to kind of pay for these services. And there should be naturally evaluation for the, as you said, the value-based services. Somebody has to. I mean, I have a report of, I think, Accenture, where they had done a survey of the people in United States, where they say the consumers are open to virtual care from basic to specialty services. 62% in the people in United States are ready for health and the wellness advisories. 57% for remote monitoring of ongoing health issues. 52% for routine appointments. 46% for mental health appointments. 45% for appointments with medical specialists for chronic conditions. 44% for appointments with medical specialists for diagnosis of acute care, and 42% diagnosis for illnesses, diseases, and disorders. So, I mean, this is the figures in United States. I am sure that you can reduce it by at least 75% for our country. But I think the pattern will be more or less similar. I think we have a huge opportunity, sir. We have a huge opportunity to, I would say, transform healthcare. And I don't think we should look at it merely from the prism of only digital health or actual health. We have to integrate everything if you want to create a value-based, transformed healthcare. And this will require a much larger vision than looking at it segmentally.
So suffice it to say that we need to have a healthcare system, digital healthcare system, wherein it addresses the issues of affordability, accessibility, and accountability with quality built into it. And it should have a viable, sustainable remunerative model. I think on that note, we've gained some great insights from the stalwarts of healthcare delivery in India. All of you belong to a generation which saw the actual development of healthcare in India, the structured, focused healthcare in India. So we are indeed very delighted, and we are very honored and indebted to you, all of you. General A.K. Singh, sir, I would request if you could say a few words as a note of thanksgiving, because this is a fantastic panel that we've just witnessed.
I think so. It's an amazing thing that we have got, the insights that we have got. One of the things that what Dr. Vijay Agarwal would like to hear is that every time I go to a village and I see a computer which is of no use, so I call it a technological graveyard. The best thing is that it is very easy to purchase hardware, but to implement it, it's the most difficult thing which is there. So technology will come, but then don't create a graveyard there in the villages, because it's very difficult to dispose of a computer. With this, I thank you very much, Dr. Saab, both of you, and lovely hearing from you. Thank you.
Sir, if I may take the
Very much.
liberty, if I may take the liberty with General AK Singh, the outgoing president, and myself as the incoming, I would like to request the both of you, because the two of you are the original stalwarts and the pillars of healthcare delivery in India. So yes, I mean, both of you know that things are going on. We have already reached out. You have reached out to us. We have reached out to you. So let us cement that bond between your societies and the Telemedicine Society of India, so that we can do justice to this dream of ours, which is to provide, to divide, to bridge this healthcare divide in India and the provision of healthcare delivery to the masses.
Thank you.
This is something that I earnestly desire and implore you to.
Sir, we are with you, and you will understand that the CAHO had, in fact, filed a case in Supreme Court
Yes,
for the
yes,
issuance of the telemedicine guideline.
yes. And it is just then the TPG was issued. Yes, yes.
Yes. So
Thank you so much.
We'll make it happen.
Yes.
Yes, sir.
Thank you
Well
so
done.
much. I think we've concluded the session.